The most common misconception would be that physiotherapy is massage. Physiotherapists don't do massage. Yeah. My name is Jacqueline Karendi. My role at Bena Care is the Chief Physiotherapy Coordinator. A patient's well-being, first you have to ensure you work with other medical practitioners. It has to be a multidisciplinary team, and you have to allow, if it's the nurse or the doctor, each one should play a key role so that you can give a comprehensive treatment plan for the patient. You have to ensure a certain level of physical activities, you maintain a healthy weight and your lifestyle so as to avoid opportunistic conditions and other lifestyle conditions such as diabetes or cardiovascular conditions. Physiotherapy is mostly associated with low back pain. For low back patients, the most conservative treatment method is physiotherapy, which offers there are no side effects to physiotherapy treatment, for it is not invasive and there are no medications involved, so that means there are no side effects. That is for the musculoskeletal conditions. For patients post-ICU, you find that their oxygen levels are low, so they require that you have to suction them. You have to do chest physiotherapy to clear the airways to ensure that the patient breathes sufficiently. When you go to geriatrics require regular exercise program. Even if they don't have any conditions, their muscles have started decreasing in functionality, so they require a regular exercise program and a lifestyle that ensures that they have a better life. First sign would be muscle weakness, instability, and body aches that are maybe localized maybe to a specific area such as a joint or a muscle. That would indicate that you need a physiotherapy. Typically what you'd normally do, you can go maybe to your nearest hospital and first seek the opinion of your clinician or doctor, and then the doctor, in most cases, physiotherapy cases are referrals from doctors. The most common misconception about physiotherapy is that physiotherapy is massage. From the name physical therapy, it's physical therapy, so that means it doesn't involve any surgery or medication. That does not necessarily mean that massage will solve. I'll give a classical case of maybe a patient with low oxygen levels. The option there would be chest physiotherapy and maybe suctioning. For that patient, let's say if you do massage, the massage would not work for her for her or him to raise the oxygen level. So the most common misconception would be that physiotherapy is massage. Physiotherapists don't do massage. Physiotherapy is a wide range of treatment, including preventative rehabilitation. That includes giving for postural correction, for those that maybe for injury prevention. What we mean, let's say a case of sports injury, let's say you have an ankle injury, that means you have to be taught how to manage with the ankle injury, whether to stop the activity, what you should and you shouldn't do to prevent further injury, and how to align the leg so that next time you may have the correct biomechanics. By that I mean how to handle yourself to prevent getting an injury or condition. That also works for low back pain, because it may be low back pain, for example, it occurs over a long period of time, and it may be due to postural deformity, maybe for example for those that work in the offices or drivers. So if they had earlier education, which is a preventative measure, it could have prevented the low back pain issue. Our community can learn more about physiotherapy services offered at Bena Care through our website, which is www.benacare.or.ke, or our social media handles, which is Facebook, Instagram, and LinkedIn at Bena Care Limited.